Thank you very much.
Thank you for chairpersons who were with us online. Now we are going to begin with the inauguration of the workshop. So I now welcome on stage our chief guest, Professor Dr. CVK Mohanty, sir, ProVC, KIT University. Principal KIMS Bhubaneswar, Professor Dr. Ambika Prasad Mohanty, sir. Air Vice Marshal, Professor Dr. Ramachandra Das, sir, Medical Superintendent KIMS. Dr. Pranab Mahapatra, sir, President, Indian Psychiatric Society, Odisha State Branch. Dr. AshruMochan Sahoo, Assistant Professor and Honorary General Secretary, IPS Odisha State Branch. Everybody kindly give a huge round of applause for everybody on stage. I request Dr. Debadatta Mahapatra to join us on stage. She's from AIMS Bhubaneswar, Chairman CME Subcommittee, IPS Odisha. Dr. Sudipta Kumar Das, Associate Professor and Organizing Chairperson of today's workshop. May we have a big round of applause for our honorable dignitaries. I request Ms. Shirley Raj and Dr. Jigyasa to kindly felicitate our honorable dignitaries on stage. Now I request Dr. Sudipta Kumar Das, Associate Professor, Department of Psychiatry, KIMS, for the welcome address. Please welcome him with a round of applause.
Respected luminaries on the dais, Professor CVK Mohanty, the Vice Chancellor, Professor Ambika Mohanty, the Principal, Professor Ramchandra Das, the Medical Superintendent, Dr. Pranab Mahapatra, the President of IPSOSB, Dr. AshruMochan, Sahoo, Honorary Secretary IPS of Odisha State Bank, State Branch, and Dr. Debadatta, the Organizing Secretary of the CAP subcommittee. The august audience present here and the motivated professionals which are connected through us in the web. I welcome you to this interesting session of therapy in everyday practice. As you know, in common life, the medicines do help changing the mental state, but we also have observed that simple word or maybe a simple talk at the right time, at the right circumstance, by right person can also change our attitude towards life and behavior also. We have seen that in the literature that giving a scientific therapy, psychotherapy by a trained professional can change our brain functions. The recent advances in cognitive neurosciences have proven beyond doubt that these kind of psychotherapy can induce changes in the brain and neuroplasticity and thereby modifying the behavior. If you look at the history of psychotherapy, it started with simple psychoanalysis, then it got expanded to different kind of psychodynamic therapy, then it came to cognitive approach like cognitive therapy, then some of the scientists came to behavior therapy. Now it is a buzzword, which is dialectic behavior therapy. And from our distinguished speakers, you will be able to learn about therapy in everyday practice. Sometimes it can be eclectic or the amalgamation of all these therapies. And these therapies are not gossips. Therapies are not befriending services. These are technical, these are scientific, and they are structured enough to and designed to give a particular goal, that is alleviation of distress and improvement of mental health functioning of the person. So without much delay, I can say that I welcome all to experience the usefulness of this practice in everyday therapy. Thank you.
Thank you, sir. Now I request Principal of KIMS, Professor Dr. Ambika Prasad Mohanty, sir, for addressing the audience. Can we please have an applause for him?
Thank you. Respected Pro Vice Chancellor, Professor CVK Mohanty, Professor R.C. Das, our Medical Superintendent, Dr. Arvindra Brahma, who is the General Secretary of this Indian Psychiatric Society, Dr. Pranab Mahapatra is the President of Indian Psychiatric Society of the Odisha State Branch. Dr. AshruMochan Sahoo is from Medical College Baripada, is the Honorary Secretary of the Odisha State Branch. Dr. Debadatta Mahapatra, the Chairman of the CME Committee. You have already been, the welcome has been already over by the Professor Sudipta. I'm not going to welcome all of you again and again. The idea is those who are offline and online are there, and CME is a requirement. CME in the form of webinar or so-called hybrid or online is a thing of the date now. Rather in KIMS, we have been holding CME almost every week. So this is a very good effort by the Department of Psychiatry. They have been able to mix it up with the national workshop. Nice of them. I thank them once again, and I welcome all the delegates, students, all the branches of medicine who are here to take advantage of this CME. And this should not be confined to this hall now. It should go and it should be circulated to all the people in the form of some publication and some way of dissemination. Thank you.
Thank you, sir. Now I request our chief guest, Professor Dr. CVK Mohanty, sir, Pro VC Kit University, for addressing the audience and to give his kind words regarding our webinar and workshop.
Respected principal, sir. So I'm telling sir, it's because Dr. Mohanty is senior to me. He's just like my elder brothers. Dr. Das, our medical superintendent, other dignitaries present on the dais, and all the participants who are participating in these webinars, offline or online, as well as the allied speakers. So CME is conducted to enrich the knowledge, to refine the knowledges. And today, the Department of Psychiatry or the Association of Psychiatrists, they are conducting this webinar, CME, through the webinars. That is in hybrid models. And the theme of this CME is therapy in everyday practice. We all are doctors. We do treat patients. So that is the therapy. We do therapeutic interventions. We take care of the disease or diseased persons. But is it complete? The health is defined as the total physical, social, and psychological well-beings. Practically, being a physician, I am treating patients. I am thinking that my patient is an object and I have some aberrations or diseases I am treating. But each disease will have its physical components as well as psychological components. First things. Always, we physicians, within the scope of our professional approach, we take care of the physical problems. How many of us, they do take care of the psychological problem that is associated with disease or that is linked to the stress of the disease? So that is most important, that must be taken care. Anybody having any disease means you will have some psychological stress. So nowadays patients are coming to physicians, they're thinking that so I may be exploited. So from the beginning, many patients, they do not trust the physicians or treating doctors. So that is the conflict nowadays between the patient and healthcare personnel. Always the patient will try that he will enjoy the autonomy of taking decisions within the limits of his knowledge. He is not expert, but still in his mind, he'll think that he will enjoy the autonomy of taking decisions. That is happening with patients. That is happening with patients' attendants in our practice. Suppose somebody is getting serious, getting admitted to the ICUs, always attendants, they do try to prevail upon the treating physicians at times, but medical practice is such a practice that one must be available always. A behavior must be cordial, behavior must be soothing so that he will develop a trustworthy environment with the patients and their relatives. While interacting with the patients, he has to, patient must rely on the decision of the patient or doctors. He has to believe the doctors and his actions. So for that reason, the psychotherapy is most important. So that is not physical therapy, psychotherapy. Because unless you build a trust with the patients, definitely the outcome will not be 100%. You will not be 100% successful. So for that reason, therapy must be oriented or must be directed for physical therapy as well as psychotherapy. That means adequate counseling. So every human being is a counselor. From the beginning, during our childhood, our mother was the best counselor. Subsequently, our teachers, colleagues, everybody is a counselor. At the time of crisis, the other man tries to, as a human being, other try to counsel close persons. So everybody has capacity. But therapeutic psychotherapy means that is being conducted or that will be given by the either psychiatrist or psychologist or psychiatric nurses or doctors, even anybody relation who is or any caregivers particularly. That is the therapeutic psychotherapy. But by nature, everybody can be a psychotherapist. Everybody can counsel a person, and everybody will can elevate the mental status of a patient or a person, and he will have confidence, and finally the outcome will be very good. So in this webinar or seminars, there will be many speakers who will tell on these things. Similarly, while dealing with the patients, I will advise all doctors, including psychiatrists, that they should devote some time to counsel the attendants and the patients. So patients, naturally, it's because the patients will have no option for choice. He has come to you means definitely he has accepted, but not with complete trust. At times, again, when he suspects that whether this doctor is doing good or bad or doing the right things or not. And so naturally, they may consult others. So that is the right of the patient, that we should not interfere. Suppose somebody will ask that I will take some second opinion. Let him take the second opinion. What is the harm to us? Suppose we are right. So all these things should be taken care. Patients should be given confidence. Patients should be given the positive hope. But that doesn't mean that you'll give them a false hope. Suppose somebody is critically ill, outcome is likely to be very bad. So at that time, you just reveal the truth to the attendants, at least not to the patients. Not to the patients. Because patients should live with hope. The attendants must know about the truth. So that is the psychotherapy. And I hope this webinar or CME program will be very successful programs, and that will imbibe a sense of responsibility and responsibility to each and every physicians amongst us. And it will also add a human touch to our profession at least. With this, and thank you everybody. Again, I must thank all the participants that because of their presence only, this CME is going to be a success. Thank you.
Thank you so much, sir, for your encouraging and inspiring words. Now I request Dr. Pranab Mahapatra, President IPSOSB, to address our audience and share some wisdom.
Good afternoon, everyone. Respected dignitaries on the dais, Professor C.B.K. Mohanty, Pro VC, Professor Ambika Prasad Mohanty, our principal, Professor R.C. Das, and our senior office bearers, Professor Raju, Dr. Arvinda Brahma, and possibly Dr. Alim Siddiqui, and all those who are offline and dignitaries of the dais who are sitting here. I welcome you all to today's program. Today is the first program by the IPS Odisha State Branch. Coincidentally, as a president, I can say that I've been associated with KIMS for last more than 15 years, and we have seen through all these stages, like it was, there was hardly an administrative block when I joined, and through all this journey, I've been with the KIMS. It is a great privilege for me to see that my first program as the IPS President, Odisha State Branch, it is taking place in KIMS itself. I'd like to thank all those members of the Odisha State Branch who have thought it, who have voted me as the President of the society, and my particular focus will be to increase the academic orientation or research orientation of the society. So in this context, I feel that written in a pandemic world where there is a shadow pandemic of psychological disorders on the backdrop of COVID, it is very pertinent that this particular topic, that the psychotherapy in clinical practice, it is very much relevant. For that reason, it is very much necessary to upgrade our clinical skills of everyone, those who are attending this this CME. So for that reason, I believe that it is a very important topic. We need to work on it, whether it is for this CME itself or beyond it. We need to focus so that we can give better services to the society as a whole. With this, I would like to end my talk. Thank you very much for this program.
Thank you so much, sir. Now I request Air Vice Marshal, Professor Dr. Chandra Das, sir, Medical Superintendent KIMS and BBMH, to address the audience. A round of applause, please.
Good afternoon, everybody. At the outset, we're breaking the chain because I am the homemaker. Suppose I supposed to speak at the end, but we have to go for a emergency meeting. That's why we break the chain. Just after that, unfortunately, this is an urgent meeting. We have to move out along with Pro VC and Principal. Sir, let me start addressing the dais. Everybody, you must be knowing all of them. Professor C.B.K. Mohanty, our ex-DMAT and Pro Vice Chancellor. We are lucky to have him with us. He is a very busy man. Our Honorable Principal, Professor Ambika Mohanty, he is head of the Department of Medicine. And our President IPS, our own Dr. Pranab, Dr. Sudipta is our Organizing Chairman. Russell must be here, Organizing Secretary. And Secretary IPSOSB ASO. And of course, Chairperson CME Debadatta. And I tell my duty unless address Tufan Bhai sitting on the front and Professor Sujit, and which is HOD Some Hospital, and the people on the dais, not here of course, online dais, Brigadier MSBK Raju, ex-president. I hope he's there. And the Dr. Simon, I think he spoke just now before from St. John's, and the faculty from CMC Vellore and Wardha, MGM Wardha. A lot of people I think joined on online. And our Professor Secy was head of the Professor Emeritus Nephrology. He was sitting here for a long time. He just left it. He came before me and he was attending all the conference, all the lectures before inauguration. First thing that the theme they selected is very interesting. Therapy. Most of the people now, they are not doing therapy because there is a inherent deficit in our medical education system. Except premier schools and colleges, there is nobody doing therapy. Now probably of late we are focusing on therapy. So this is one of the best things that we did it, that focusing on a therapy, and that too in a collaboration with all the medical colleges of Odisha and IPSOSB branch. That's a big bridge and jump. Aim is that everybody should benefit, not me alone. Wherever the medical students are, PG students are there, interns are there, they can benefit it. Our DMT told very nicely, sir, ଆପଣ ଲୁସିଡ୍ ଓଡ଼ିଆ ଭାଷାରେ ତ ବୁଝେଇ ଦେଉଛନ୍ତି ଯେ ଆମେ କହିପାରିବୁ କାଉନସିଲିଂକୁ ଆପଣ କେତେ ଭଲରେ କହିଦେଇ ଗଲେ ମାନେ everybody can understand what the meaning of counseling, but probably they are talking about a little professional counseling, little bit different, but anyhow this term starts from there. The issue is that people have forgotten the counseling for two reasons. Hey, sorry, I forgot Professor HOD Ames is also sitting there. I'm very sorry. So Visu. Second, what I think people have forgotten totally about the therapy for two reasons. Therapy actually the only vision where Sigmund Freud brought mentally ill patient from mental asylum to the chambers. That is called the revolution in psychiatry. From mental asylum to the chambers. But unfortunately, over the period of time, because of lack of evidence or lack of time or economic constraints, lot of things, the therapy has gone down and better medicines are available for treating with that. But of late, we understand that therapies are as important as medicines and they are complementary to each other. So the therapy which have been focused now in present day session, in our session today, is very pragmatic, which you can do practice in your day-to-day practice. That's the important of that. Here in a clinic, how you can practice your therapy. Two young faculty and our professor of psychology, she is also speaking on a direct behavior therapy. I'm sure all will be benefited. CVK Bhai has given me an ultimatum. We have to go within 5 minutes because we have a meeting. So 3 of us are going. We love to stay here for some more time. But unfortunate, Russell is sitting there with his full team. He totally, completely organized it. He didn't want to come to the front. Big applause for Russell. And we'll come back after some time, but we are going for some urgent meeting. Thank you. Thank you.
Small change of plans. I would request our honorable dignitaries to kindly felicitate our honorable speakers who will be presenting in the second half. So first, I would like to call on stage Dr. Secy Mishra ma'am. Please give a huge round of applause for her. She'll be speaking about dialectical behavior therapy. I hope you all are expressing your curiosity regarding the same. I would like to call Dr. Sudipta. Everybody, please give a huge round of applause for her as well. I would like to call Dr. Udit sir. Round of applause, please. Thank you so much, everyone. Now I would like to request Dr. AshruMochan Sahoo, Assistant Professor, PR MMC Baripada, and Honorable General Secretary, IPS Odisha State Branch, to address the audience.
Namaskar. Good afternoon, all the delegates present on the dais and of the dais, and special thanks to the participants, those are attending in virtual mode. My heartfelt congratulations to the organizing secretary, Dr. Ravan, and the organizing chairman, Dr. Sudipta, for organizing first event of Indian Psychiatry Society Odisha branch in this year. Today is a great day for me, as it is the first event of my tenure as the Secretary of Indian Psychiatry Society Odisha State Branch. I also thanks to President Dr. Pranab Mahapatra, CME Chairperson Dr. Debadatta Mahapatra, Professor Dr. Secy Mohanty, Dr. Ashidas, and thankful to Dr. Mohanty sir, Sujit sir, and Vishwaranjan sir. I am also grateful to the member of the staff of KIMS and KIT deemed university and the founder of this institute, Honorable Dr. Achut Samant. I should congratulate the organizing team for organizing a seminar on the topic therapy on everyday practice, which is very useful in the current practice. All of us face the situation that a few of our patients come to us, tell us, sir, I'm counseling ପାଇଁ ଆସିଛୁ, medicine ଖାଇବୁନି. So we come for the counseling, not for the medicine. So at times they feel that their problem is not so much big. The medication, only counseling will help them. But I believe the margin between the insanity and the sanity, the normal or the abnormal, or we say psychosis or neurosis, is narrow. There is a regular shift from one zone to another zone. If one person remains more time in the abnormal zone, there is need of the help of the mental health professionals. There is a popular saying in Hindi, "Dunia goal hai, yahan sabka double role hai." It means every person has both good sides and the bad sides. So it is important and also challenging for the mental health professionals to choose the appropriate therapy for the patient. All of us know the first ever psychotherapy holy book is the Srimad Bhagavad Gita, which is tested and trusted by the time, where the Lord Krishna has elevated the consciousness of the Arjuna from depression to liberation, that from Visada Yoga to Moksha. So we, the mental health professionals, should work with work like Lord Krishna to bring changes in the betterment of the society. Today, we have an eminent speaker of national and international repute. They will definitely enlighten us about the importance of psychotherapy in everyday practice. We know that every rule has an exception. Beginners know the rules and the veteran know the exception. But I believe this platform will help the transfer from beginner to veteran, and this will elevate the consciousness and improve the professional efficiency, which is ultimately help the betterment of the society. Thank you.
Thank you, sir. Now I request Dr. Debadatta Mahapatra ma'am, Assistant Professor, AIIMS Bhubaneswar, and Chairman, CME Subcommittee, IPS Odisha State Branch, to address the audience. A round of applause, please.
Respected dignitaries on the dais and off the dais, Dr. Mohanty sir, Dr. Vishwaranjan Mishra, my HOD, Dr. Sujit Sahoo. Previously, I had worked with him, Dr. Sudipta Das, the organizing chairman, Dr. Ravan, organizing secretary. It is a proud moment for me to address the gathering. As CME chairperson, I also say the same thing. This is the first program by Indian Psychiatry Society Odisha State Branch. For all the office bearers, it's the first event organized, and a big thanks to the organizing team KIMS for organizing these events and giving us the opportunity in spite of this COVID third wave. They have organized it in person, in the hybrid mode, in person, and also in the online mode. Before telling anything, I want to announce one thing. Within 2 days of invitation in the IPS group, Indian Psychiatric Society group, more than 100 psychiatrists from all over India have shown their interest to participate in the CME. And today also on the online, we can see more than 140 people have logged in that I have seen. I guess now there will be more people. Before few years, therapy used to be a fascinating term or a layman term. Some people are not at all ever fit, and used to go to the therapist. We don't know anything, but now you can see among the 4 eminent speakers, 3 are psychiatrists, and psychiatrists are also aware of this. I like the theme very much, bringing therapy into clinical practice or everyday clinical practice is very much required. There are it not only will help the patients, but also it will give the psychiatrist a unique place. Then there are lots of studies that show that not only pharmacotherapy, though all the psychiatric disorders have biopsychosocial model, but though we all accept there are biological factors, the psychological and social factors cannot be neglected. There are lots of studies, meta-analysis, though, that prove that pharmacotherapy with psychotherapy is definitely required for better or significant improvement. Now, this Herculean task was possible by Dr. Russell Ravan and Dr. Sudipta and all the organizing team. I thank all of them for organizing this event. Thank you all.
Thank you so much, ma'am. Now I would request Dr. Udit Panda sir to announce the prize winners of the quiz competition we had earlier in the morning.
Thank you. Before I announce the winners of the quiz, I would request Professor Dr. Tufan Pathy to please come onto the dais. So we conducted a MCQ-based quiz today before the program started in the morning. We had interns from 3 medical colleges who participated in the program. So, yes. So the winner for the quiz is Dr. Radhika Kedia from KIMS. Dr. Radhika, if you are available, please come onto the dais. Do we have a batchmate of hers who can collect the prize? Yeah. Dr. Sarmista, can you collect the prize on our behalf? I would request Dr. Tufan Pathy sir to please felicitate Dr. Sarmista on behalf of Dr. Radhika Kedia as the winner of the quiz. Yeah, so I think people have gone for the lunch. We choose a wrong time to announce the winners. Dr. Radhika Kedia, Dr. Sarmista is receiving the prize on our behalf. The second prize goes to Dr. Vivek Kudavala from KIMS, and I would request Dr. Pranab Mahapatra sir to please felicitate him. He's also not available. Dr. Secy, thank you so much for receiving the prize on our behalf. Can you receive the prize on our behalf? Thank you so much. The third prize is Dr. Vishal Chaudhary, intern from KIMS as well. I would request Dr. Debadatta Mahapatra ma'am to please felicitate Dr. Vishal. Dr. Jigyasa, Vishal is around. Vishal, come over. A round of applause for Dr. Vishal. He's the third prize winner of the quiz. Fast. No, you come first. You are the second prize winner. Okay, your prize has been received and you can collect it from here. Dr. Vishal, yes, come over. Dr. Vivek is the second prize winner. Congratulations, Dr. Vivek. Dr. Vishal Chaudhary is the third prize winner. I would request Dr. Debadatta ma'am to give the prize to Dr. Vishal. We have a joint third prize winner as well from High Tech Medical College, Dr. Swetapadma Mohanty, if you are available. Dr. AshruMochan, I would request her to please felicitate Dr. Swetapadma. Please give a round of applause as well. Dr. AshruMochan, thank you so much, sir. So congratulations to all the winner. I'm taking the liberty to ask everyone to break for lunch, and we'll meet at 2:30. I am the speaker for the next session, so we'll be speaking about principles of motivation and interviewing. I hope to see you all back. Let's break for lunch. Thank you so much.